Does cerebellar stroke always requiring prolonged rehabilitation? Imagine a stroke in the part of the brain that helps us keep our balance and coordinate our movements. That's a cerebellar stroke, and it can cause problems like unsteady walking, difficulty with fine motor tasks, or speech issues. But does that mean everyone needs months or even years of rehab? Not necessarily. The need for prolonged rehabilitation really depends on how severe the stroke was, what specific parts of the cerebellum were affected, and how well the person responds to therapy. Cerebellar strokes can vary a lot from person to person. Some might experience mild symptoms that improve quickly, maybe within a few weeks or months, with just a short course of therapy. Others with more extensive damage might need longer, more intensive rehab programs to regain their independence. The brain's ability to adapt, called neuroplasticity, is strongest early on after a stroke, so starting rehab early is crucial. Physical therapy focuses on improving balance and coordination, while occupational therapy helps with daily tasks, and speech therapy can address speech or swallowing issues if they occur. For those with severe strokes or complications like bleeding or swelling, recovery can take much longer. There are cases where patients have undergone over a year of dedicated therapy, gradually regaining mobility and independence despite initial setbacks. Recovery often happens in phases, with rapid improvements early on, followed by periods of slower progress or even plateaus. Some patients might experience setbacks but can continue to improve with ongoing therapy, especially if they stick with home exercises and outpatient programs. Every rehabilitation plan should be personalized. Some might need assistive devices like walkers or braces, and modifications at home to keep safe. Emotional and psychological support are also important because recovering from a stroke can be challenging mentally as well as physically. The goal is always to help each person regain as much function as possible and improve their quality of life. So, to answer the question directly, not all cerebellar stroke patients requiring long-term rehab. Some recover quickly with short-term therapy, especially if the stroke was mild. But many, especially those with more serious damage, benefit from ongoing intensive rehabilitation that can last many months or longer. The key is early intervention, tailored therapy plans, and continuous assessment. Every stroke is different, and recovery depends on many factors. Always consult healthcare professionals for personalized advice and support.